Well, concussion in sport is an issue that should concern every parent. Most people go through their sporting careers relatively unscathed, but more and more evidence suggests many receive head knocks that result in lifelong issues. Sport at the highest level, like the AFL, have doctors on hand to intervene if they think a player receiving a big knock is concussed or not. But that is not the case at the social and amateur levels. But now what could be a breakthrough? Pharmacies around Australia will be trialling a test for concussion using a virtual reality headset. What's it all about? Candice Smith is the CEO and founder of Sciana Australia. And Candice joins us now. Candice, good morning to you.
Good morning, Graham.
Concussion is something that's concerned and worried many people for many years. There seems to be difficulty in diagnosing it. Long-term effects are unknown. At the worst, they can be horrific. What about this new test could be a breakthrough?
Yeah, it really is a huge issue and getting more concerning, which is part of the problem. So the statistics, with technology seem to be, rather than on the decrease, they seem to be on the increase. And you mentioned the issue in sport, but for us at Sciana, the broader question is that, sports grab headlines, but 80% of concussions actually happen off the field, and so just in the community. And so that's really what we're trying to do with making these tests accessible through pharmacies is the one important thing. And so ensuring that everybody in Australia has access to be able to go and do a screening check and be triaged into care quickly and easily. And then the other thing is the actual technology. So the subjective nature of current concussion assessment protocols has really resulted in some challenges. So, a questionnaire and under-reporting as well. So you've mentioned in sports and kids, not wanting to be removed from play. And so the objective data that we get from the NeuroFlex technology is really critical in accurately assessing the brain function and getting these kids and adults, many adults, into the correct care pathway.
So how does your testing work?
It uses, as you mentioned, a virtual reality headset, so similar to what you would have seen in gaming. And it's 8 short exercises or short tests that are used, and then the eye and head movements are tracked over the course of the exercises, which then, as I mentioned, provides that objective data on vestibular-ocular and oculomotor function, which helps in the assessment of cognitive function and then ultimately brain health. And so the recommendation is that everyone, and particularly kids and particularly those playing sport, go for a baseline test, which helps you, which is then stored and is your brain's normal function. And then after an incident, if there is the suspicion of something more sinister, to go back to the pharmacy again where this baseline would have been stored, and to have another check to enable the correct referral into a care pathway that's relevant for a concussion, if that is a concern.
So there's no way of faking it. As you say, that at the moment the sports people are very keen to get back on the field, and if they can fake it, a concussion test, they will, and they do. You're saying it can't be done with this test? No,
it can't be. So it's I'll give you an example of one of the tests. There's a dot that moves around the screen, and you just have to follow it with your eyes. And what the AI technology does is it tracks the way your eye moves as it's following that dot. And I'd be very impressed with someone who was able to fake that test. And so the objectivity of the data that's collected is what's really critical in ensuring that the underreporting that you've mentioned becomes less of an issue, because the real catastrophic impacts of these injuries come when you get an injury on top of another one. So the important thing is that they are rehabilitated and treated effectively to ensure that those really serious impacts aren't realized.
So what are the costs involved to undergo one of these tests?
It's, as I mentioned, it's in pharmacies, and it's $89 for a check. It's a 15-minute appointment with the pharmacist. You go onto our booking system, select a pharmacy from the network, and it's 15 minutes for the appointment and $89.
So that gives you your baseline reading. So if there's an incident, someone receives a head knock in some way, they can go back to the pharmacist and
Yes.
go through the test, and it will show whether they've got concussion on it effectively.
Yes, it is part of a broader screening tool, so it certainly will refer you. We also have a referral network of a number of trained neurophysiotherapists and GPs. So if there are any areas that need further investigation, you're referred directly into that network to receive the correct treatment. Importantly, though, the Neuroflix technology has been around for long enough that they have sufficient normative data that if you haven't had a baseline test, you can still go for a check and you can be compared to the normative data. But everybody's brain is different, and so really important to encourage, particularly kids to go for baseline testing.
Now, you're saying there are tests in pharmacies at the moment. How many pharmacies around the nation will be involved?
So we're in the process of our rollout. We've done a pilot, and we have around 30 pharmacies currently, but are growing that, on a weekly basis. And at the end, our plan is to have the entire Australian pharmacy industry covered.
It sounds like we use the term breakthrough too often when we talk about medical developments and so forth, but this seems to be a real breakthrough in the area of concussion testing. Candice, thanks for your time today.
Thanks so much, Graham.
Candice Smith, CEO and founder of Sciana Australia. What are your thoughts, folks? A test for concussion? You need to do a baseline testing. It costs $89. Yeah, it's a lot of money, but if you have a child, for example, who's going to be playing sport, take them in for the test. You've got that baseline test, so anytime they do have a head knock, you take them back to the pharmacy, they can do a check, and you can find out pretty well straight away whether concussion is a factor or not. And let's face it, concussion can be a lifelong issue. If it goes undetected, it can get worse and worse, and we've heard some horrific results of that. What are your thoughts? 8223 0000.